Today, Dr. Brian Kennedy will present his research work under the title 1 Year of Trump, the economic impacts of President Trump's very interesting topic. Okay? And Dr. Brian Kennedy received the PhD in economics from the George Mason University in 2009. His work focused on the business cycle fluctuations, public choice economics, law and economics, industrial organization, and public finance. So you have around 40 minutes for your presentations, okay. And then we will follow by the question and answer.
Okay.
Okay, the floor is yours.
Okay, as you said, I'm Dr. Brian Kennedy. I am an American. I am also a Republican. I did not used to say that, but then the Bangkok Post published that I was a Republican, and then people knew it, so there's no point in hiding it anymore. And in Asia, that's not a big deal. In the US, it might be career suicide. But there it is. I did not vote for Donald Trump for a variety of reasons. I could not force myself to vote for him. I did not vote for the other one either because I found equally unacceptable. I'm not going to go into all of Trump's behavior, the tweets, the things he says, etc., at least not in my presentation. If you have questions about that, I'll address those issues to an extent. Rather, I'm going to try and concentrate on what's actually happened in the last year since President Trump became president. For what it's worth, I would probably vote for him at this point. He does actually have accomplishments, not all of them bad, at least from my perspective. But I'm going to try and go through that, and I'm going to try and limit this as much as possible to the economic effects. Understand, President Trump is he is more of a cultural phenomenon than an economic one. And a lot of these fights that are going on in the US are really not about economic issues, they're about cultural issues. But I'm going to try and steer away from them to the extent possible. And so I'm going to break the talk into basically two major parts. The first part, I'm going to talk about the institutional constraints that President Trump is operating under. He is a singular figure. He is a unique figure. But singular, unique figures in American politics, even presidents, don't get things done. You have to have people working for you. And in the case of President Trump, that means the Republican Party. And they have to run for elections as well. They have an institutional memory, and they have a lot of opinions and a lot of beliefs about what should happen that are either different than Donald Trump's or that they want to present in different ways with their own agendas, etc. Many of them, before the election, took the attitude that we will be here, hopefully, long after Trump is gone, because most of them didn't think he'd win the election. Democrats were certain Donald Trump would not win the election. I think it is fair to say that Donald Trump probably didn't believe he would win the election in the last couple of days. And then he won the election. So the first part I'm going to talk sort of about the constraints, because that goes a long way towards explaining why Republicans are doing things the way that they are. But also because it will help you to better understand what's being written about Donald Trump. The prime reason that I'm writing this paper is because everyone has been asking me about Donald Trump. And everyone, as the American, everyone asks me about Donald Trump. They ask, well, why is he doing this? Why are they doing that? This looks insane. A lot of it isn't. There is a purpose behind some of the madness, and there is a Republican Party that is doing a lot of other things in addition through the vehicle of Donald Trump. That's really not being reported well. And so I want to go through some of those issues and sort of explain the logic of what they're doing. Second part, I'm going to talk about the actual things that have happened, which will center on the fight over healthcare. So first I'll cover the fight over healthcare. Second thing I will cover is tax reform. Understand the tax reform bill hasn't passed yet. They're still changing it. Like this morning, they changed it again. So that part is going to be more speculative, but I think it's still largely accurate. Then I'm going to cover the administrative state and the judiciary. The reason I'm covering that is because I think that's probably the most important issue in the US right now, and it's the one where Donald Trump is paradoxically having the most impact. And I think that impact is going to be very long-lived in comparison to Donald Trump, who may or may not be able to win a re-election. Or, you could argue, may or may not survive his first term. Russian investigations ongoing. Then I'll cover trade and immigration, and then, but I'll cover that fairly briefly because not much has happened. And then I will cover the energy sector just because it touches upon some of the other issues and because it has become the engine of US growth in the last year or so. There'll be other issues I'll touch on as well, but those are the primary ones I want to cover. I am not an expert in all of those areas, although I've learned a lot in some of those areas researching this paper. So that said, why did President Trump win? There's dispute about this. I think that there's 4 key reasons. The first one is he was not Hillary Clinton. Hillary Clinton was a uniquely awful candidate. The joke in US politics as the election was going is Hillary Clinton is everything that's wrong with American politics, and Donald Trump is everything that's wrong with American culture. And I think that there's truth to that. But Hillary Clinton was not she has never been a popular candidate. This was her second time running for president. The first time she lost to Barack Obama. She would have lost the nomination to Bernie Sanders if the DNC hadn't intervened and essentially cheated on her behalf. She had that horrible email scandal, but she would have had something else, because that's just sort of fundamentally who she and the Clintons were. So that's the first reason. I think there were 2 good reasons to vote for Donald Trump. One of them was that he wasn't Hillary Clinton, and the other one was judges, which I'll get to in a bit. But there were a lot of cultural issues that were driving this election. There's a large segment in the US that feels that the Democratic Party sneers at them. And it sneers at them over issues like, why is it necessary for the federal government to mandate that nuns buy contraceptives? Why do they have to do that? In that view, that's not a big economic issue. It's just a case of the government trying to force nuns to do something because that's what they think they should do. And on a whole host of things, there are views like this. Many people in the US don't believe in gay marriage. Well, if you don't believe in gay marriage now, you're a bigot. Just like, apparently, Bill Clinton, Hillary Clinton, Barack Obama, and Joe Biden all were way back in 2012. I mean, that was 5 years ago, and none of them were in favor of gay marriage. But now, if you are in favor of it, now, if you're not in favor of it, you're a horrible person. Well, people pick up on that, and Donald Trump became their representative. But those are cultural issues. They're not economic ones. There were economic issues as well. Trade and industrial policy. Mostly, these are rural American issues. Rural America has been going through a fairly slow but fairly steady economic decline. Wages have been somewhat stagnant. Certain kinds of jobs have been disappearing. There's been talk of a brain drain out of rural areas as people move to the cities. I tend to think that's overstated. But rural America does not feel that the Democratic Party supports them anymore. They sort of feel that the Democratic Party has become a party of very wealthy liberals who care more about cultural issues. And this was especially important because these kinds of voters were concentrated in the Midwest, the area where Donald Trump eventually came to win the election. And then a final issue that I do think is important is just the pendulum effect. It's very hard for one party to maintain the presidency for more than 2 terms. Basically, since World War II, since President Truman in 1952, since then, only once, Reagan and the first Bush, has a political party managed to hold the presidency for 3 terms. It's a hard thing to do. People just after 8 years seem to get tired of the incumbent president and the incumbent president's party. So you can argue that as well. The 4 electoral, or the 4 constraints I'm going to talk about now on President Trump. First of all, the electoral complaints. The electoral constraints. The electoral constraints simply refers to the fact that in 2018, a lot of Republicans are going to be up for election. And it is not clear that Donald Trump can help any of them. Donald Trump, so far at least, Donald Trump seems to is having the same effect that Barack Obama had. Barack Obama was very good at getting votes for Barack Obama, but he hollowed out the Democratic Party in the process, where when he left office, there were a lot fewer Democrats in Congress, in the House, in the governorships, at the state level than before. And there's plenty of evidence to suggest that Donald Trump may do the same thing to the Republicans. There is the bureaucracy. Donald Trump hates the bureaucracy, and the bureaucracy hates Donald Trump. I don't know any other way to put it. There is open resistance, as well as a lot of covert resistance to President Trump in various parts of the bureaucracy. And he's been having trouble staffing the bureaucracy with his political appointees. Conversely, Donald Trump, for reasons I'll talk about, has his own problems with the bureaucracy. The Congressional Budget Office. Anytime you're reading about legislation, you will be reading about the Congressional Budget Office as well. And I'm going to talk, and I'm going to take 5 or 10 minutes to talk about how the Congressional Budget Office actually operates. Because the press treats CBO numbers as if God created them, and they're not. The numbers, for a variety of procedural reasons, the numbers have some difficulties, but furthermore, for political reasons, the numbers are becoming less and less trustworthy. Basically, politicians have learned how to game the system, and they're doing so with great abandon now. And then I'm going to talk about the role of the filibuster. And I'm going to do that because, while most people know what the filibuster is, kind of, it's important to know when it does and does not apply, because that has shaped all legislative efforts in the U.S. Congress. Okay. And then the economic agenda. I've sort of already talked about these, so I'll just skip over this for now. Okay. Electoral constraints. President Trump won the Electoral College. We all know that. That's why he's president. He lost the popular vote. We also all know that, because Democrats never, ever fail to mention it. No, he lost by about 2 million votes. Of those 2 million, 4.3 million were in California. And that's an important thing to note, because that process is going to be repeating itself a lot. I'll talk about that in a moment. House Republicans, conversely, got 63.17 million votes. Democrats in the House only got 61 million. Donald Trump ran behind generic Republican. Donald Trump was less popular than the generic Republican vote. Hillary Clinton was more popular than the generic Democrat vote, although only by a very small amount. And this is important to note. Donald Trump was not the only winner that night. He was the surprise winner, and so that's what we've talked about a great deal. Republicans were expected to get massacred in the Senate. They were defending a great many Senate seats in a lot of places where it looked like they were going to get wiped out. In the end, they only lost 2 Senate seats. House Republicans also were expected to get wiped out. They ended up losing 6 seats, a very small number.
Brian,
Yes.
could you just explain a little bit about the philosophy of why the U.S. political system give more weight to electoral votes than popular vote?
Yes, actually, I'll be getting to that.
Okay.
That's actually here, the next slide. The U.S. electoral vote system slightly weighs votes towards smaller rural states. It does this for 2 reasons. One, because when the Electoral College system was set up, small states were not willing to join the new country unless they would be adequately represented, as in they would get enough of a vote to actually matter. There were 13 colonies, but 3 of the colonies, Virginia, Pennsylvania, New York, had more than half the population. And those 3 colonies, therefore, in the new country would be able to dominate everything. So, as part of getting the small states to join the country, 2 things were created. A Senate, which would give every small state some extra vote, the same number of senators as a large state. So, for example, Wyoming, which has a population of just over 500,000, sends 2 people to the U.S. Senate. California, with a population of almost 49 million, sends 2 people to the Senate. Wyoming is heavily overrepresented in the Senate. Wyoming, likewise, is overrepresented electorally, where it gets 3. The number of votes you get in the Electoral College is equal to the number of representatives you send. So that's the number of senators, 2, plus the number of congressmen. Wyoming sends 1 person to the House, 1 congressman. California sends about 50 people to the House. So California has more votes in the Electoral College, but has the same number of votes in the Senate, and overall the system is weighed slightly towards the smaller states. The smaller states tend to be more rural, and rural voters tended to go for Donald Trump. This is why, one of the reasons why he won the Electoral College, even though he lost the popular vote. The other reason that this is the case, though, is because of the civil rights movement and gerrymandering. In the 1960s, the U.S. House passed what became known as the Civil Rights Bill, or the Voting Rights Bill. I want to say it was in '64. And one of the goals of that was to create minority-majority districts. In other words, a district where a majority of the voters would be of some ethnic minority. And the logic behind that was as follows. If you have a district that is 30% black, you'll never elect a black politician, because whites who are too racist will never vote for a black guy. So the only kind of Democrat who can win in a district like that will be a white Democrat who will get the black vote, which is overwhelmingly for the Democrats, plus whatever percentage of the remaining 70% are Democrats. Well, that was considered to be unfair. So you want to have some black politicians who actually have a chance to win. The way you do that is you create a district that has a majority of black voters. But when you do that, note, if blacks are voting 90-95% for Democrats, well then half of the district is voting for Democrats, at least. Now, if the rest of the district is 50-50 between Democrats and Republicans, Democrats are going to win that district with 75% of the vote. But what this does is it now concentrates the Democratic vote into a smaller number of districts. And you can see that effect in the House of Representatives, where the average margin for Democrats is much, much higher than the average margin for Republicans. What this effectively means now is Republicans, who did get a majority of the vote in the House, 49%, ended up getting about 55% of the House seats. This is also related to gerrymandering. Gerrymandering is the habit of drawing congressional districts in such a way as to ensure that there's enough voters of one party to get someone reelected. And both parties do this. Democrats dominated the process until about 15 years ago. since then, Republicans control the majority of states, and therefore they've been participating in it as well. But the parties collude on this a lot, where, you know, politicians will scratch each other's back. If you're an incumbent, you come to an agreement with other incumbents, and we'll all have nice, safe seats, and then we can go back to fighting about whatever it is we fight about. These two things mean that the House also, for structural reasons, tends to favor Republicans. I think the amount that it favors them is overstated. I think in a good wave election, Democrats can easily take the House, and they can easily take the Senate. They've certainly done it before. So these are small advantages to Republicans, but they are real advantages. Okay, the 2018 election. Republicans have a tremendous advantage in the Senate. 2016 was expected to be bad for Republicans. The way U.S. Senate elections work is only 1/3 of senators are up at any one time. Senators serve for 6 years. Every 2 years, 1/3 of them are up for re-election. Now, just because of the vagaries of the cycle and some path dependency issues related to previous elections, Republicans are only going to be defending one seat in a state that Hillary Clinton won. Democrats will be defending 10 Senate seats in states that Donald Trump won. This means that if it's a good electoral year for Republicans, they can pick up a lot of Senate seats. Probably not enough to get, probably won't get to 60 and beat a filibuster, but they can pick up a lot. Conversely, even if Republicans have a bad year, it's hard to see how they lose control of the Senate, unless they have a really bad year, which could happen. That said, the last two off-year elections have been pretty brutal for Republicans. They lost the Virginia governor's race, which hurt, but they weren't really expected to win it. But then they lost a Senate race in Alabama, and they lost that just a week or two ago. And that was a special election to replace the Alabama senator who, Jeff Sessions, who became Donald Trump's head of the Department of Justice. And that was a shellacking. Donald Trump won Alabama by 28%. The person who ran in the Senate seat, a man named Judge Roy Moore, lost the race by about 2%. That's a 30% swing. Judge Moore got less than half the raw votes that Donald Trump did. Now, he was a uniquely awful candidate. He was really a terrible candidate for a whole number of reasons. If you're a 30-year-old man, you should not be trying to date 14-year-olds. And if you do, you shouldn't run for election. No matter what you say, you're going to look bad. So what you draw from that is hard to judge, but you cannot ignore a 30-point swing. And that implies, both that and the Virginia election, imply that Republicans, at least at this moment, are going to be in trouble in 2018. And that's kind of the current conventional wisdom, which I guess I would agree with, although a lot can change between now and then. Okay. Second constraint is the bureaucracy. There is this illusion that the American presidency is a strong position. It is not. American presidents are actually pretty constrained in what they're allowed to do. And most of what happens in the US government is a function of the bureaucracy. And let me give you, I'm going to give you a simple Thai example. When General Prayut took over, what changed? Did the traffic lights stop working? Did the buses stop? Did the BTS stop? What changed? I mean, did BE get a whole new administrative staff? Did the police change? Nothing changed. I mean, you know, people talk about Thailand used to be a democracy, now you're not a democracy. And that's true. But at a practical level, nothing changed. Because the bureaucracy just kind of keeps grinding forward and doing what the bureaucracy does or what the bureaucracy doesn't. U.S. system is the same way. A president has only limited ability to get the bureaucracy to do what he wants. The bureaucracies tend to do what the bureaucracies want to do, or what they think they should be doing, or they don't do anything. Which, you know, let's face it, a lot of government bureaucracies don't really do anything. And that's probably a good thing. Note, however, that in the view of a lot of Republicans, the nature of the U.S. Federal bureaucracy has changed. And this goes to the IRS Tea Party scandal. This was a scandal where the IRS appeared to be targeting members of the Tea Party. The Tea Party movement in the U.S. was a very anti-Obama, anti-large government movement that basically was arguing for smaller government, less taxes, and less government, and a lot less government. Oh, and we don't want any government. So that's basically what the Tea Party was arguing. The IRS systematically began targeting those groups and denying them tax exemption, and targeting them for other sorts of tax investigation as well. Now, there is still dispute as to why this happened. Some people argue that this was a deliberate policy by the Obama administration and that the president ordered it, or senior people in his administration ordered it. There has been very little evidence that comes out to suggest that. But no, the alternative explanation is not much better. The alternative explanation, therefore, is the IRS decided on their own that they were going to start investigating American citizens because of their political leanings. Well, that's an IRS then that doesn't need to be ordered. That's an IRS that understands what its interests are. Its interests are not electing Republicans and electing Democrats. In other words, they weaponize themselves. A lot of Republicans feel that a great many parts of the bureaucracy are like that. That the only government the CIA could overthrow is an American president. That the only thing that the FBI is interested in investigating is Republicans. I'm not saying that this is all true, but I am saying that this is a very strong current of this thought among a great many Republicans. This belief that the bureaucracy is now serving its own interests. Okay. The Congressional Budget Office. The Congressional Budget Office was set up by Congress because they felt the OMB, the Office of Management and Budget, was not, which is an arm of the executive branch, was not providing them with good data. Before that, the Office of Management and Budget would prepare a budget for submission to Congress. This was done by the President. Congress would then take that budget, modify it as Congress saw fit, and then eventually would pass some kind of budget. Congress felt that presidents were sending budgets with unrealistic assumptions. So they created the CBO, the Congressional Budget Office, to be an independent arm of Congress charged with scoring legislation. In other words, the job of the CBO would be to tell us what's going to happen with any given piece of legislation. Now, the CBO worked for a while. Okay, for a while, it was producing very good reports. But note, CBO projections, in order to compare different pieces of legislation, you have to be judging everything by the same criteria. And the criteria that the CBO uses, there are three things that are key. One, they only project out for 10 years. Note, the CBO is in the job of projecting. This is not like standard economics. A lot of standard economics is we look at past data sets and then we figure out from there, well, what happened. CBO has to tell Congress how much something is going to cost in the future. They'll only do it for 10 years. on the very reasonable assumption that you can't really make predictions about the world much past 10 years. It's based on the law as the law is written. What this means is that when they look at it, they actually look at how the law is written, and that's how they're going to make the judgments. And then they're statically, not dynamically scored. That means the CBO, for small bills, it doesn't matter. But for very large bills, they're not taking into account effects the bills might have on the underlying parameters. Okay, that is to say, the CBO, if they change taxes, they're not going to figure out, well, how will this change in taxes affect unemployment? How will this change in taxes affect the incentives for firms to do certain kinds of things? Some of that will be within the scope of the law, but a lot of it won't. And note, all of these were agreed to by both parties. Both parties wanted it this way. You want 10 years because then you always know, you're always comparing apples to apples. Everything is scored for 10 years. Based on the law as written because you're submitting a law to the CBO. A different congressman can write a law, submit it to the CBO, CBO will score it. And then they wanted it to be statically analyzed. Democrats wanted it that way because they didn't want any tax bills to appear to be less costly because of any kind of Laffer curve effect. So basically Democrats were hostile to dynamic scoring. Republicans were also hostile to dynamic scoring because they felt that it's a bureaucracy, and any bureaucracy that's given the discretion to dynamically score it will start scoring our stuff wrong, because that's what technocrats always do.
That is what effect that they do, because you say that they not look for the unemployment, still we have the tax bills, right? So what affects that?
They'll still look at the direct effects that the tax bill will have. How many people will stop paying for the taxes? How will some forms of behavior be changed? But all of the CBO models have underlying parameters. Think of it as one of these big Keynesian input-output models, which will assume certain things about elasticities of demand, certain things about elasticities of supply. Those elasticities will not be adjusted for any of the legislation that's occurring. And I'll get into an example of it in a bit. It's easier to see when I show an example. Okay. Now, how does this affect things? Well, let me talk first about Obamacare. It was politically very important in the passage of Obamacare that the program only cost $1 trillion. $1 trillion over the next 10 years. The problem with Obamacare was there was no way to increase coverage and to mandate that everyone get better coverage, i.e. more things covered with their health insurance, and bring it below $1 trillion. So the Democrats did two things. The first thing is they delayed the implementation of Obamacare till 2013. So they didn't start the program for 5 years. But all the taxes in it, they started right away. These were some special surcharges on capital gains, medical devices, etc. What this means is that Obamacare, as written, had 10 years of revenue and only 5 years of spending. Well, the CBO can only score it for 10 years. The CBO knew they were being gamed. I mean, they knew it. They knew, hey, 3 years after this program's in effect, you're going to be way over $1 trillion. So that's the first example. But there was also the doc fix. The doc fix was, in order to gain control over medical expenses, the U.S. Congress in 2000, or at some point in the early 2000s, had passed a bill that basically said all Medicare and Medicaid payments can only go up by the rate of inflation. So if a hip surgery cost at the time $35,000, it can only increase in cost by the rate of inflation. Now the problem is there's been constant medical inflation in the US. Healthcare costs are going up way higher than the rate of inflation. And after 2 or 3 years, doctors really began to complain about the fact that they were getting paid, relatively speaking, less and less. So Congress intervened. They intervened and they did a one-off cap to supplement the payments that doctors were getting. And this became known as the doc fix. And this was politically very popular. Now everyone in Congress can go and say, look, we voted to help the poor people and the elderly by increasing the amount of money that goes into these programs. Now, that money was only going to poor elderly doctors, and there aren't very many poor and elderly doctors in the US. It was doctors getting money, but you know, doctors contribute to political campaigns. So you're gaining in both ways. It was so popular that they did it again the next year, and the next year, and the year after that. They ended up doing it 17 times over the course of about 13 years. But what this meant now was that by the time of Obamacare, the gap between what officially doctors were receiving and what they were actually being paid had risen to 25 or 30%. So in the writing of Obamacare, Democrats said, oh, and we will just retain, you know, the current rules about spending. Well, the doc fix was always a supplemental thing. So essentially Obamacare was assuming that you were going to be cutting payment to doctors by 25 to 30%. That made it substantially cheaper. But no one, everybody who studied it understood Congress was going to pass another doc fix. In fact, while Obamacare was being voted on, Congress was also debating the next doc fix. So those are examples of trying to game the system. I don't want to imply that Republicans don't do it. They do it as well, and I'll talk about an example of that. This figure here shows the CBO's projections for the individual market in Obamacare. If you look up here, these are the projections that they were making early on. Looking for my, okay, here's the 2010 projections. They were projecting 12 million by 2015, 20 million by 2016, last year, about 22 or 23 million by 2017. And I've got projections that they made in 2010, 2012, 2014, and 2016. And this is the actual number. Less than half the enrollment that the CBO was projecting. This was not, I want to stress, this was not the CBO intentionally screwing things up. This is the nature of making projections. The CBO is good at it, and they are. The CBO did better than most private people who are trying to analyze this. They were still massively off on their projected numbers. And we'll need to come back to this because these are still the official CBO numbers. And it makes a big difference when you're trying to score other kinds of legislative stuff. Finally, the filibuster. This is an old Senate tradition. Yes? Excuse me? Oh, okay. Yeah, okay. The filibuster is not in the Constitution. It's just something that kind of came about over time, although the people who wrote the US Constitution almost certainly would have approved of the filibuster, because it essentially requires that you have a supermajority to do something. The way it works is you have a debate, and one side just keeps on talking about the issue, and therefore you never get a chance to vote because one side refuses to stop talking. If you can get enough votes to shut them up, which was traditionally 2/3, later 60% of the vote, then you could call for closure and say, okay, we've talked enough, now we're going to actually vote on this. So traditionally you'd set aside some time for debate, and then if you could get the votes to force closure, you would force closure. The system has changed in the last 30 years. It used to be about the minority forcing a long debate about an issue. It's now about the minority ensuring that there never is a debate. The minority simply asserts, we're going to filibuster this. do you have the votes to overcome the filibuster? And if you don't, there's no point in bringing it to the Senate. But no, they don't actually have the debate anymore. And the filibuster tradition, as politics in the US has become more polarized, I think you could argue that the filibuster is more necessary than ever, but that's not what's happening with it. In 2013, Senate Democrats ended the filibuster for judicial nominations other than the Supreme Court, and they ended the filibuster for any cabinet level appointments. In other words, what they said is no, from now on those are simple majority rule. But they did not have a filibuster-proof majority to do that. They couldn't come up with 60 votes to do that. So what they did was they had a rule about motions. Basically, 52 of them said, well, we're going to change the rule about the filibuster. And since it's a rules vote, it's not subject to the filibuster. So they changed that, blew up that Senate tradition. Then the next year they lost control of the Senate, which they really didn't expect to happen. Republicans, conversely, in 2017 said, okay, well, we're going to end it for judicial nominations. And that's how we got Supreme Court Gorsuch. The filibuster still survives for other sorts of things, but it's not clear to me that it will. Donald Trump has no interest in maintaining the filibuster. Now, budgetary actions are not subject to the filibuster. You can't have a minority holding up the budget by talking forever, because then the government just doesn't function. So, Obamacare regulations constrain insurers to only offer plans that include all kinds of extra benefits. If I move back to the US, I have to buy an Obamacare-compliant insurance package. That package will be much more expensive because of the regulations. But those regulations don't affect the government's budget. So those regulations are subject to a filibuster. If Republicans want to change those regulations, they would need a filibuster-proof majority. In other words, they would need 60 votes, not 50. However, a lot of people can't afford those regulations. Therefore, they get supplemental money from the US federal government, which subsidizes their purchase. That money comes out of the budget. So that is not subject to a filibuster. But if the regulations are interacting with the regulations are interacting with the budgetary supplements that are being put in, does that mean that the regulations are having a budgetary impact, and can you therefore filibuster them or not filibuster them? Now, if this has confused you, don't worry. It has confused Republicans as well. No one knows, I do not know the answer to this question. No one knows the answer to this question, really. Because there's this obscure government functionary called the Senate Rules Orderly, a not particularly well-paid bureaucrat who works for the Senate, who this whole thing got dumped on his desk, and he just kind of said, I don't know. But these are the problems now with the filibuster. Basically, everything has a budgetary impact, but then that means nothing is not subject to the filibuster anymore. Although Republicans are still acting as if everything is. Okay. All right. That's the institutional constraints and stuff that I wanted to talk about. So let me now go into the big issues. This is a good place to stop. Are there any questions about what I've talked about so far? I know some of this that I've talked about is kind of dry, but it's very important for understanding what's actually going on. There's a reason Republicans have to do things the weird ways that they're doing them. Okay, Obamacare. Okay, first of all, let me put everything out on the table. I think Obamacare is a monument to awful. And that's not a case of I'm hostile to government health care. I am, but this is a separate issue. Obamacare is bad government health care. It is really bad government health care. And it was in a lot of trouble before President Trump became president. That's the other thing. Obamacare has never worked as it was supposed to work, as those CBO numbers would indicate. Remember, CBO was projecting 24 million people would be in it now. Okay. Less than 10 million are. Well, you know why? Because people hate it. It never worked as it was supposed to work. Well, okay, we'll get to that issue. Right. The way Obamacare works is two things. One, it expanded Medicaid. Medicaid is just a large government-run medical insurance system that provides health care to poor people. And that has been the major impact of Obamacare. Most people who've been enrolled in Obamacare have actually come in not through the private markets, but just through an expansion of Medicaid. And Medicaid has a big problem. No one can demonstrate that Medicaid actually does any good. A lot of studies have been done with Medicaid to sort of show what the health outcomes are for people who have it versus people who don't. And you really can't find very good evidence that Medicaid has an impact. This is different than Medicare. Medicare is for the elderly. Medicare does have a positive impact on the lives of the elderly. How much is debatable, but it definitely does seem to do some good. Medicaid is really hard to find benefits to it. It also, Obamacare took over the individual market. Now, the way Obamacare was intended to work was, one, everyone would get better insurance. Obamacare mandated that from now on, insurance companies have to offer plans that cover everything. They cover your birth control. They cover your cold medicine. They cover, if you want sex reassignment surgery, it will cover that. So they mandated that health insurance cover a lot more things than had been the case in the past. But it also did so by the imposition of community standards. A community standard is a range of prices that the insurers could sell the insurance at. Essentially, if you were old, okay, someone who's 65, on average, will spend about 6 times as much in any given year on health care as somebody who's 25. Therefore, insurance for the elderly, health insurance for the elderly, was much more expensive. What Obamacare did was it capped that range at 3 to 1. In other words, if you were if you were old, you could only be charged 3 times as much as the insurance company was charging a young person. What that meant now was that the insurance companies, would have to lower the price of health care for the elderly. But in turn now, insurance companies would also have to raise the price of insurance to the young. And this way, the young would be forced to subsidize the elderly. Now, these community ratings had a lot of other subsidies built into them as well. So, for example, women consume more health care than men. So men were effectively subsidizing women's health care. Mothers consume more than single women. So single women are now effectively subsidizing in the case of mothers. Everyone is either being subsidized or is paying for these sorts of subsidies. Now, the problem with this is the young wouldn't get insurance because they're going to be overpaying for it. So Obamacare also created the mandate. The mandate was a program that basically said, we will punish you and we will charge you money, the federal government will, if you don't buy an Obamacare compliant insurance policy. So the government would, I think the current mandate is $750 or 2% of your income, whichever number is, I want to say higher. I'm a little constrained by this. I've never been into the Obamacare program because I won't give them my name. I live far enough away that I don't want the US government to have my name in Obamacare and then suddenly be subject to a mandate or something. So I've never actually gone into the website for it. Okay. The introduction to Obamacare was a disaster. which you probably heard about. How, they created this whole thing and then no one could log into it. And at the same time that no one could log into it, millions of people lost their health care. No, the people who lost their health care were people who were using their own money to buy their own insurance, which in econ speak means people who liked their insurance. Many other parts of the program still don't work. One way they were going to control costs was through a medical advisory board that would dictate what kinds of medical conditions Obamacare would and would not cover. No one's even been appointed to that board, which 3 years ago was supposed to be dictating these kinds of cost controls, risk corridors, etc. And Obamacare has always been subject to the death spiral. The death spiral is the idea that you would get adverse selection and too many young people would withdraw. You need 40% of Obamacare enrollees to be young in order to subsidize the elderly who are in it. That number has never been above 30%. And large numbers of young people just pay the mandate. Or until yesterday, large numbers of young people simply paid the mandate. So the Obama administration has had to constantly raid other funds, other sources of funding to kind of prop the program up. And insurers have been dropping out of the program. About a third of US counties now only have one insurer offering insurance on the marketplace. Okay. Ryan Care was the Republican attempt to fix this. And conceptually what Ryan Care argued is that Obamacare was a fundamental misdiagnosis of the problem with US healthcare. The problem with US healthcare isn't isn't access, it's cost. Anyone in the US can get very, very good healthcare as long as you can afford to pay for it. The problem is sometimes people couldn't afford to pay for it, and some people could never afford to pay for it. Why are costs high? Costs are high because of third-party payers, government interventions, and changes in the healthcare and the insurance markets. The problem with Medicaid, conversely, is that it doesn't produce good outcomes. And it doesn't produce outcomes because it's treating health insurance that people don't pay for as if it was the same product as health insurance that people are willing to pay for. But the people who aren't paying for it are not treating it the same way. And you need to directly address those problems, which I'll come back to. Medicaid, therefore, also needs to be fundamentally rethought. There is also arguments about Medicare, but Republicans did not pick up on any of those arguments in this part of it because the way Medicare is funded, it absolutely is subject to the filibuster, and therefore Republicans never had a chance of reforming it. And this is just a graph of healthcare spending. Here's life expectancy, 75 up through 85. Here's cost, and here's the good old USA. We're lagging in life expectancy, and we are spending much, much more than other countries. Okay. All right. Ryan argued U.S. health outcomes are fine. Okay. Once you take account of behavior. So in other words, going back to this, lower U.S. lifespans, that is not a function of our healthcare system. What Paul Ryan and a lot of Republicans argue is that is a function of the way Americans behave. We behave in a more risky manner. And there is a lot of data to support this. If you look at, I'll give the example of gun deaths. If you get shot in the stomach, you're about 3 times as likely to survive that wound in the US as you are in France. Because American doctors have learned a lot about treating gunshot wounds because of our wars in Iraq and Afghanistan, and because American doctors see a lot of gunshot wounds. You're much more likely to survive a gunshot wound in the US. That's a good thing to say about our healthcare system. Note, you're also much more likely to die of gunshots in the US because about 10 times as many people get shot in Chicago as get shot in Paris. And whenever you look at specific medical interventions, the US is pretty consistently among the top 10 countries in the world. But when you look at the aggregate data, US life expectancy tends to be lower. US life expectancy has gone down since the introduction of Obamacare. Let me be clear, Obamacare did not cause that. One of the things that seems to be driving it is the opiate crisis. If you look at deaths in the US due to opiate drug overdoses, those numbers have quadrupled in the last couple of years, and they're still trending upwards. Now, by this reading, if somebody on their 5th trip to the emergency room with an overdose, if they die, that may be a tragedy. But it's not an indictment of the healthcare system. The problem isn't that there's something wrong with the American healthcare system. The problem is somebody went to the emergency room 5 times with an overdose. And a lot of that seems to be driving this kind of data. That said, the cost is also excessive. Even if we give you an anecdote that I just came across, who are the longest lived people in the world? Japanese women. And you know where the longest lived Japanese women live? In the state of Connecticut and Rhode Island. And I think that that does tell you something about it, about the way a lot of other Americans are behaving. Okay. Just as a point of interest, anyone who's doing work on health outcomes across countries loves to use Japanese as their data sample. Because the Japanese don't intermarry when they go to other countries, or they intermarry at a far lower rate, and therefore you have racially pure Japanese all over the world, but using other people's health systems. So it's a good thing to use when you're making these kinds of comparisons. Okay. Since our outputs are fine, we need to address why is it so expensive. US healthcare is a system based on World War II price controls and very high tax rates in the 1950s. To do this really quickly, in World War II, a price ceiling was put into effect to help fight the war. So companies that were trying to attract better employees, well, I can't pay them a higher wage, but I can give you a car. I can subsidize your housing. Hey, I can buy you health insurance. So that's where the system of companies buying health insurance for workers first began, and it proved to be popular. And it retained its popularity after the war because marginal tax rates in the US at times would reach something like 90%. When you have a 90% marginal tax rate, there's not a whole lot of point in getting paid extra money. When I was growing up, I had an uncle who, at the time I knew him as Uncle Oreo, because he was a very well-paid executive at Nabisco. But they just gave him everything he wanted. He had a new car every year, and whenever he came over, he always had a big new car full of Oreo cookies and other kinds of cookies because of very high marginal tax rates. So Nabisco goes to him and says, well, we could buy you a $10,000 a year healthcare policy. Or we could pay you $10,000 and the IRS will take $9,000 of it. Yeah, okay, I'll take the healthcare. And that's kind of how it all got cemented as companies pay for that. And then the companies who don't want to actually manage the healthcare put it on to the insurance companies. And now the insurance companies are the ones who are actually managing the healthcare. This worked until the 1980s. Until the 1980s, this largely worked because most healthcare was one of two things. It was routine care, which you still paid for yourself, or it was catastrophic care. Catastrophic care means I go ice skating, I slip on the ice, and I break my leg. Now, if I slip on the ice and I break my leg, that's going to cost me a lot of money. but it's also going to end. After a year, I'll get better. Now, you might get cancer. If you get lung cancer in the US in this period of time, it's still catastrophic care. They open you up, they cut out chunks of your lung, and either you survive or the cancer has already metastasized, which means the cancer has spread elsewhere and you're not going to survive. But at that point, you're only going to be getting health care for a limited amount of time, and it's not particularly expensive health care. Because the insurance company is now in the business, not of curing your cancer, they can't. They're in the business of dealing with the pain. And that's not a particularly expensive thing to do. So up until the 1980s, this all worked. What's happened since is a new category of care, which we would now, a new type of care, not catastrophic care, but chronic health issues. Take, for example, Crohn's disease. I have a friend who has Crohn's disease. It is a disease where the immune system periodically attacks the body. And a person with Crohn's will break out in hives, they'll get intense intestinal difficulties, etc., because their immune system is so powerful, it attacks their own body. That used to be a death sentence. By the time you were 30, one of the Crohn's disease attacks would have killed you. It's no longer a death sentence. Okay, my friend has a reasonable shot at living to be 70 or so. But he requires constant medication, and once, maybe twice a year, he goes into the hospital for a week or two when his Crohn's disease flares up and attacks him. He is going to be costly forever. And that's not what insurance does. Now, I've been talking so far as if health care and health insurance are the same thing. They're not. Insurance is something you use to protect yourself against a catastrophic risk. It's not something that you use to pay for your constant medical expenses. And insurance companies don't actually have a lot of skill at doing that. Think of owning a car. When you own a car and you buy auto insurance, the auto insurance deals with your having a crash. It doesn't pay for your gas. You pay for your own gas. But now imagine if auto insurers had to insure drivers who also happen to be blind. Well, if you're insuring a blind driver, you're going to be paying for accidents every couple of weeks. And no insurance company would touch said driver. Well, you have the same issue now going on in the healthcare market. And if you look at these numbers, it's really striking. The top 1% of spenders in the US account for 20% of the spending, just by themselves. The top 5%, 49.5% of the spending. What's happened because of that is this small number of people who are being paid for through insurance are deforming the whole insurance market. And that became the basics of Ryan Care. The basic fundamental issue for Ryan Care was we need to take these people out of the regular insurance market so that insurance can go back to doing what it does well, dealing with catastrophic risk. These people, conversely, we need to put them in a separate program. What in the US we call, for reasons I don't know, high-risk corridors. People who are moved into high-risk corridors, now the government will directly deal with their healthcare issues. That means in the insurance market, you'd see a tremendous drop in the cost of insurance for the 95% of people who are still buying insurance, because they're no longer subsidizing these chronic cases. And now the theory was insurance will go back to operating the way that it should. Now, once that's happened, normal price mechanisms can start to work again. In other words, people will start to see what the prices are. My father, Democrats argue that because healthcare is so important, you can't let the market deal with it. What Ryan is arguing is that because healthcare is so important, we need to let the market start dealing with it. And this really goes to assumptions about whether or not you can economize on health spending. My own view is that you can economize on health spending. My father is currently in Thailand because that part of his medical care that is not being paid for by Medicare, he's very sensitive to the price of that. And that includes his dental work. So he came to Thailand to get dental work done because it would be 1/3 to 1/4 of the cost as it would be in the US. But when he asked me how much would it be, I went to a dentist, I took a picture of all the prices because that dentist had the prices right up there. I have never seen the price of anything posted in a US doctor's office or a hospital or a dental office or anything else in my whole life in America. I've never seen the price of anything posted. And that goes to why other healthcare spending now is so expensive. It's always somebody else spending the money. And no one is as careful about economizing when it's not their money. Brian Care wants to make the marginal cost of healthcare positive again, so that we stop consuming it like an all-you-can-eat buffet. Okay. So, in the individual market, incentivize the states to create high-risk pools. In the case of Medicaid now, conversely, he wanted to just block grant it to the states. This is based on the 1996 welfare reform, which was a program in the US to basically take all the welfare money, all the welfare spending the federal government was doing, shift that to the states, and then tell the states, spend this as you see fit. A program that by and large was very successful. Okay, so this was the plan. It suffered 3 problems. The CBO scored it as a massive cut. Because it's ending the mandate, and the CBO was assuming that everyone would still respond to the mandate someday, they scored it as a massive cut. The press never understood it or never cared to understand it, and so they tended to misreport on it. President Trump did not help the issue. And then there were other problems with it as well. Furthermore, when it went to the Senate, and if you read my paper, I go on a lot about this, but I'm trying to speed up because I'm taking a little long. When it went to the Senate, all of it got worse. Because in the Senate, Republicans only had 52 votes. That meant any two or three senators could hold the whole thing up unless they got something they wanted. And the Senate had a collection of senators. There were about 10 senators who were threatening to hold it up unless they got this thing or that thing. And by the time you had rewarded enough of them, what resulted was an incoherent mess that looked ugly to everyone, and it eventually died when it became apparent that they would never get the Senate votes. I bring this up, okay, I spent a lot of time talking about something that didn't happen, because it's not over. The pre-existing problems with Obamacare are still there. The Trump administration has restored the short-term loophole. The short-term loophole refers to traveler's insurance. A lot of Americans figured out that, well, if you come and visit the US, people buy health insurance called traveler's insurance. Well, why can't I buy traveler's insurance? And I'll just keep renewing my traveler's insurance year after year. So the Obama administration, not through the legislative effort or anything, banned the purchase of travel insurance consecutively. In other words, you could only get it for 3 months unless you were a student and you could prove it, and they did all kinds of things to prevent people from doing it. Because the traveler's insurance was what a lot of people wanted. Basic old catastrophic care. The administration has also ended cost sharing. This was all the money that was being raided from other accounts to prop up the insurers and to keep them in the market. Because a lot of insurers said, we're going to withdraw from the market if you don't keep subsidizing us. Cost sharing refers to a program in Obamacare where insurers who made a lot of money, i.e. made excess profits, would have to share those profits with insurers who were losing money. That way insurers wouldn't all just charge a really high price. They'd compete for customers and they would compete on the basis of price. The problem is, nobody ever made any money on Obamacare. None of the insurers ever actually were able to turn it profitable, which meant there were no profits to share, which meant the people who were losing were just losing. And the Trump administration ordered the IRS to not enforce the mandate. And the Republican tax bill that may or may not pass tomorrow also has ended the mandate. And that gets us to tax and entitlement reform. Any questions about Obamacare and the healthcare crisis? No?
15 minutes and then we can ask.
I'm going as fast as I can. Yeah. Entitlement reform. This is publicly held debt in the U.S. There's supposed to be a line here at this point right here in 2017. Publicly held debt in the U.S. is going up. The Republican tax bill, this does not take that into account. I produced this before that. So that number will go up by some additional amount. These numbers are ugly, but not catastrophically so. But notice, as recently as 2005 or so, the debt was relatively low. And the debt has been exploding in the last 15 or so years. Last 10 to 15 years, the debt has exploded. President Bush doubled the national debt. President Obama doubled that doubled number. President Trump is not going to reform entitlements. He's not going to do it. Democrats are not going to do it. Paul Ryan, the Speaker of the House, made his career, made his name as the person who is willing to talk honestly about entitlement reform. He won't talk about it anymore. The U.S. is not going to reform its entitlements anytime soon. I see no prospect for it whatsoever. The U.S., therefore, public debt will continue to rise. This will continue to have macroeconomic effects. I think someday, well, anything that can't last forever won't. So someday it will end. I hope it ends well. I'm not convinced it's going to end well. I don't think the U.S. will have a Greece-style meltdown, but I certainly think we could have a pretty hard landing the way France has. Or we could end up in a situation like Japan where we just have, slow economic growth and a giant debt overhang. Anyway, that's it for entitlement reform. Not much else for me to say. They're just not going to cut. They're not going to touch it. They have touched tax reform. This is going to go quick because they haven't finished the bill. Tax reform for Republicans is in two things: a reforming of the corporate tax code and a reforming of the individual code. For the corporate tax reform, it lowers the U.S. rate to 20% or possibly 21%. I think they're trying to find a little bit of extra money to pay for some other things, so they're going to raise to 21%, versus the 35% it is now, which is actually the highest in the OECD. The OECD average is, I believe, 25%. Now, in exchange for lowering the corporate tax rate, it ends a lot of corporate deductions. Not all of them, but it does end a lot of them. So the effective tax rate for U.S. corporations is going to go down, but not by as much as that suggests. But that's okay, because it's going to get rid of a lot of the distortionary behavior. I can't tell you too much beyond that, because there's a lot of different deductions that they're cutting, but they keep adding them back and taking them out until something is finalized. I can't say much more than that. It moves the U.S. to a territorial tax system, which is the way everyone else in the world does it. Basically, the U.S. government argues that any profits you get after another country has taxed you, well, we're just going to count your total profits. In other words, if Apple sells a phone in Thailand and then, or produces a phone in Thailand and sells it, and then the Thai government taxes Apple 20%, the US government says, well, when you bring the money back to the US, we're still taxing it at the full 35%. As a consequence, many American companies have a tremendous incentive to never bring the money back to the US because it's going to get taxed at a very high rate and you can't use any of the other deductions for it. So they're going to move the US to a territorial tax system. And that's how every other government in the world does it, with one or two tiny exceptions. They'll also create a one-time tax on the incoming overseas profits. This is sometimes called the Apple Clause. Apple currently has, I want to say, $200 billion parked in overseas accounts that they won't bring back to America because they don't want to pay a huge tax on it. What the Apple Clause would do is it would say, okay, you have, for the next year, you can bring it back and we will tax it, but we'll tax it at a much, much lower rate. So it would be a one-time tax, but it would bring the money back and that would provide an immediate boost to US government finances. And then there's a lot of debate about what the long-term effects would be. I just read an article this morning that basically argues this is a $45 billion tax cut to Apple, and it is, if Apple was to bring all the money back and pay the current tax rate. But the thing is, Apple won't bring the money back at the current tax rate. So, how you debate about these things depends on, where you come down on those kinds of issues. There's some very complicated mechanisms to separate corporate and wealthy individual taxes apart. You don't want a situation where individuals turn themselves into a corporation and then they pay a 20% tax rate when the actual tax rate, the high-end tax rate in the income tax range is 35%. So they have a lot of really complicated mechanisms in there that keep changing because it's not clear. It creates so many exceptions and complications, no one's been able to clearly score it, including Republicans, and they're still fighting about that. And then finally, it's abandoned the border adjustment tax. A border adjustment tax is a very complicated form of a value-added tax that basically benefits companies that produce stuff in the US and penalizes companies that outsource stuff to other countries but then bring it back into the US for assembly. Administratively, it was a nightmare, and Republicans finally concluded that, if we're setting up something that looks like a VAT, once it's set up, it could be turned into a VAT. And the US does not have, pretty much alone in the developed world, the US does not have a value-added tax. And Republicans, I think, have finally concluded that if the US wants to avoid a value-added tax, don't bring in the border adjustment tax. Because then the mechanism to collect the VAT is in place. And then it's very easy to do a 1% VAT, which will become a 2% VAT, which will become a 7% VAT, as you have in Thailand, which could become a 10% VAT, or which could become a 24% VAT, like you have in most of Europe. Okay, income tax reform. They've simplified the brackets. They've doubled the personal exemption. The personal exemption used to be $6,000, now I believe it's $12,000. And by doubling it, that ends up being a tax cut for the poor and the middle class. But they've also limited the home mortgage interest rate deduction, and they've limited the state income and other tax deductions. These are two deductions that economists for a long time have been arguing are distortionary and subsidize the wrong people. As it's written, for the vast majority of people, that won't matter because the increase in the standard deduction more than makes up for the change in the mortgage interest rate or in the state income tax benefits. But it goes some distance towards getting those things out of the tax code, and the only people who will be penalized are the relatively wealthy. Again, like the Ryan Care, the introduction of all of this has been complicated by the Senate, where, again, every individual senator had to put their fingerprints on it and kind of muck up what was once a pretty simple bill. I think all the evidence suggests it is going to pass in some form in the next week or so. I think the corporate tax, most Republicans seem happy with what it's done on corporate taxes. And as an economist, it seems to me it's going some distance towards making the system more rational. I'm less convinced that it's working well on individual taxes, but I would have to see what the final product is. The first things that they proposed I thought were all really good. But what's proposed and what's coming out, we'll just have to see. And also, it's not clear politically what the benefits are, whether this will actually benefit Republicans or not. And then the final issue that I'm going to talk about, because the other two are not that important, is the judiciary and the administrative state. And these go to issues of governance in the US. I said earlier, the best argument for voting for Donald Trump, the best positive argument, was judges. And you hear that a great deal among Republicans today. It's sometimes called the, well, what about Gorsuch argument. Where the what about Gorsuch argument is someone criticizes Trump for the tweets or something. I said, yeah, okay, he's a pig, he's a jerk, but what about Judge Gorsuch on the Supreme Court? Because Judge Gorsuch is a very impressive jurist and is already making his mark on the Supreme Court. This is as much a victory for Mitch McConnell and the Senate as it is for Trump. But President Trump has a record of appointing really good people to the court. And I mean that in two senses. I mean that ideologically, for Republicans, they're people that Republicans approve of. But I also mean that in that they're just high-quality nominees. Normally in the US, presidents, yeah, they'll appoint good judges, but they'll also appoint a judge who, because a senator from some state has a brother-in-law who's a judge, hey, could you get my brother-in-law an appointment as well? And you'll make the compromises to get, the extra votes for this or that. Donald Trump has done none of that. Donald Trump is simply doing it on the basis of a list he's been given by outside forces. And this gets us now to an entity in the US that's very important that most foreigners don't know, and that's the Federalist Society. I said earlier that I'm a Republican, and in higher academia in the US that makes me unusual. I think the latest data I saw, this is all from a social scientist I can't remember his first name, his last name is Haidt, H-A-I-D-T, who's doing great work on studying political bias and stuff like that. The number of Democrats to Republicans in economics departments in the US is about 6-1. In history departments, it's about 10-1. In a sociology department, it would be about 100 to 20-1. Which is to say, if you were to look at 100, it would be 80 to 20-1. 80 Democrats, 20 communists, 1 Republican. Higher academia in the US as a whole is about 12-1 Democrat to Republican. And this is reflected in all kinds of elements of academia. Professional associations. The Association of American Economists is dominated by Democrats. The sociology department is dominated by Marxists and Democrats. The English departments dominated by, just all down the list you go, that's the case. With one exception, and that's the law. The American Bar Association is also dominated by Democrats. And law school professors are about 10 to 1 Democrat to Republican. But the American Bar Association doesn't just represent professors, it also represents practicing lawyers. And there's a lot of practicing lawyers in the US. Enough of them that eventually some of them went and formed their own organization, which is now known as the Federalist Society. And the Federalist Society has created a parallel institution. A parallel institution that represents Republican lawyers. And now they have classes, they run a whole parallel system of professional training, of seminars, of research. They have their own journals, etc., etc. What this has meant is that in the nomination of judges, Donald Trump and Republicans have a resource that they don't have anywhere else. They have their own academia. And Donald Trump has simply gone to the Federalist Society and said, give me a list of good names. So the Federalist Society has given him a list of good names, and that's all the people he's been appointing. He has appointed a record number of judges in his first year in office. And it is starting to have an impact. If Republicans hold the Senate, I find it inconceivable that he won't appoint at least one, and possibly 2 or 3, more Supreme Court justices. Ginsburg is 84 years old and frail. Kennedy is getting ready to retire. There are other elderly judges there as well. Donald Trump could have a huge impact on the judiciary. He's already having a big impact. And this is going to make a big difference. Because there is an issue that has come to the fore in American politics. And that is the issue of administrative law. Administrative law is the laws of bureaucracy. How does the Social Security system operate? How does the EPA operate, etc.? And until recently, all of this was based on the Chevron rule. The Chevron rule, it dates back to a case in the 1980s, that basically says judges will accept what an administrative body says as the law, as long as that administrative body made a reasonable interpretation of congressional intent. In other words, Congress creates an agency, or Congress directs an agency to do something. The agency takes what Congress said and interprets what did Congress mean. Now, as long as the agency's interpretation seems reasonable, the courts will not get involved. They will defer to the agency expertise. All of that in the last 15 or so years has started to come into question because agencies are increasingly taking real liberties with how they interpret statutes. So for example, I'll use the EPA as an example. The Clean Waterways Right. The navigable waters of the United States. The EPA is instructed to deal with the water supply. And this is not for the EPA purpose, but this is written into the US Constitution. Congress has the right to deal with the national waterways because it's an interstate commerce issue. The EPA, therefore, is charged with making sure those waterways are clear. But now the question becomes, what is a navigable waterway? Well, the EPA has interpreted as anything that you could float a canoe on is a waterway that they can regulate. But it doesn't have to be a permanent waterway. And the EPA is now arguing it doesn't have to be attached to any other waterway. That means your swimming pool, for purposes of the EPA, is an interstate waterway because they can float a canoe on it. If a puddle deep enough forms on your property, that is under the jurisdiction of the EPA. Basically, it means the EPA can now regulate anything. And the EPA, based on that understanding of the rule, which no one believes Congress intended when they created the EPA. No one believes that's what they originally intended. But the EPA has argued in court that that's what they can do. And this all came to a head in a case in Idaho where someone got state permission to do something. The EPA After they did it, basically they filled in a puddle. The EPA came and said, no, you have to recreate the puddle, and you have to plant all these trees to fix the thing, and for every day you're not in compliance, we're going to fine you $17,000. That case has been going on in the courts for 10 years. It went to the Supreme Court, and the Supreme Court, the EPA's argument was, well, we did not issue a final ruling. So these people are not even allowed to go to court and challenge us until we do issue a final ruling, which they didn't do for 6 years. The couple in turn argued before the Supreme Court, what can we do? The EPA is taking our property, they're dictating this, and this has sort of become the first shot in what I think is going to be a progressive legal challenge in the US. And Donald Trump is having a really big impact on that. And I want to stress, this cuts across party lines. A lot of Democrats are also worried about this issue. I'm going to skip Woolman ice rating skate. I'm going to skip another quick example, the consumer.
For the last part. Yeah, and you can open for the fall for maybe 10 minutes.
Okay, okay, I'm sorry I've gone over. I think I will end it just very quickly. Trade and immigration. Oh, well, now I don't even have slides. Okay, very quickly, trade and immigration. Almost nothing has happened on trade. Trump has made a lot of noise, but he really hasn't made any substantial trade differences except for, you could argue, the Paris Accord. That's not really trade, that is whatever that was. And the Trans-Pacific Partnership. But Hillary Clinton said she wasn't going to sign it either. And I don't think Congress would have signed it regardless of what either of them said. And that just goes to the issue that there's widespread hostility to trade by Democrats and Republicans. Democrats because they don't like trade. Republicans because while they do like free trade, the Trans-Pacific Partnership was 5,500 pages. If it's 5,500 pages long, that's not, a trade agreement that's 5,500 pages long is not free trade. That's managed trade. And they didn't want to get involved in that because no one knows what's in a 5,500 page document. You always discover 5 years later that you signed on to things you didn't like. So that's the issue of trade and stuff. Okay, sorry for going long. Let me open it up to the floor.
Okay, thank you, Dr. Brian. I would like to open for the floor, maybe around 10 minutes. Do you have some questions?
Yeah.
Please.
Okay, thank you for allowing me
Yeah.
to have some time to ask him some questions.
Okay.
You see, from what you have explained here, I wonder whether average Americans are knowledgeable about this,
No.
about what you have presented.
By and large, no.
Okay.
By and large, average Americans are not, but they do know some of the issues.
Okay. Now, the other question is that what you have presented normally will deal with internal affairs mostly, about the well-being of Americans.
Correct.
I wonder, look at the other dimension. How much resources in the public sector that has been allocated for the well-being of Americans? Or in other words, what would be the proportion of resources in the public sector allocated for the well-being of the civilians and non-civilian? Do you have any statistic of this?
I do. I didn't include those in this because I'm trying to look at the effects of Trump as opposed to the base.
You see, I haven't come across this kind of figures, but I have a feeling that American government has spent a lot of budgets not for the well-being of Americans, but overseas and on non-civilian purposes.
Sure.
And if that resources could have been kept for, for the use of domestic purposes, American public might be much better off now.
Well, there's an assumption built into that a lot of Republicans would disagree with. And that is that the U.S. government could spend a lot of money in the U.S. effectively and wisely. Let me give the example of the Big Dig. Are you familiar with the Big Dig in Boston?
Yeah.
It was a $2 billion project to build a tunnel under Boston Harbor that would take 3 years. It took 12 and a half years, cost $15 billion, and a month after they opened it, the giant concrete panels that they put on the top began falling off because they glued them on with epoxy instead of doing them, and then they had to close the whole thing down. It was a giant government waste of money. The U.S. government can do some things well, but a lot of things it can't. The Obama administration, they did their stimulus bill. One of the things they were going to build was a high-speed train. Well, that was 8 years ago. The high-speed train has 12 miles of tracks now. It's cost about $5 billion to get those 12 miles, about 20 kilometers worth of tracks. And it's in the middle of rural California. And they're still working on the environmental impact studies. There's a real argument that one can make that the problem with the government is if you give them $1 to spend on the public, only 40 cents comes out the other end, and then it's not spent wisely. I share that particular objection. I think a lot of what the U.S. government spends its money on is just a waste. The $2 billion bridge in Alaska, the high-speed train to nowhere that's never going to get built, and that has never made any sense to be built. Any kind of infrastructure cost in the U.S. is about 10 times as high as it would be in other countries because of all the mandates about union work and stuff like that. So that's the first issue. The second issue is the vast majority of U.S. spending at this point is not on infrastructure or any kind of discretionary spending. The vast majority of the spending now is on the entitlement programs. Social Security is about a quarter of the budget. Medicaid and Medicare, I think Medicare alone is about 20%. Medicare adds another 10%. That's 65% of the budget right there. Then there's all kinds of other entitlement spending, etc. But what it means is you have very little discretionary spending left in the U.S. Military is another 20%. You could certainly argue we spend too much on the military. But if we stopped spending on the military, we'd still run a budget deficit. I mean, make no mistake about it. The military is not driving the budget anymore. Therefore, a lot of people are, not a lot of people, a lot of Republicans who are not up for election argue that we need to pare back the size of government, that's what the issue is. President Trump does not really want to pare back the government per se, but he definitely wants to cut regulations, and there are definitely parts of the government that he wants to cut back radically, mostly those parts that he perceives as being hostile to him. But that now gets into all kinds of culture war stuff, which I sort of want to shy away from. The basic problem is the U.S. is just not spending the money well at this point. And I don't have a good solution to that. I don't think anyone does. I'm sorry, I do have a solution to that. Don't spend the money. I believe a U.S. government that did less would do the fewer things better. But in trying to do everything, okay, sorry if that went long.
Okay. You have other questions? So, well, I think it's quite interesting, but one thing that you talk about the healthcare, and you say that the healthcare for the poor people is not work well in the U.S. But normally the healthcare is like one phenomenon for the healthcare to help the poor people. For example, in Thailand we have like 30 baht. This is like for the poor people. But we have some problem that, for example, the hospital don't like it because they lost a lot of money of these healthcare programs. And in the U.S., what obstacle this kind of healthcare for the poor people not working well?
The problem with the Medicare, Medicaid.
Yeah.
The problem with Medicaid is, one, there's a tremendous amount of fraud in the program. There is currently there's a current U.S. Senator who is on trial, Senator Menendez of New Jersey, because he was doing favors for a friend of his who was a doctor, and that doctor overcharged Medicaid $120 million. Think about that number for a moment. $120 million. No, that's how much you have to overcharge Medicaid before they notice it. Medicaid, they never notice if they get overcharged $500,000. It's too small of a number for them to bother with. But you know, $500,000 multiplied many times over becomes a huge issue. And the reason is because of the way Medicaid is funded. The states pay for a part of it, but for a lot of states, for every $1 they pay, the federal government matches it with $3. But the federal government doesn't actually administer Medicaid. The states do. Well, the states don't have an interest in spotting fraud. The state's interest is actually to let fraud happen. The more fraud happens, the more money gets spent, and then the more money they pull in from the federal government. And Medicaid has all kinds of perverse incentives like that built into it. The other problem with Medicaid is the way that the payments are made, it's a payment for a service. Therefore, doctors have an incentive to create all kinds of services. If I give you an x-ray, I'll get paid for it. If I give you 5 x-rays, I'll get paid for doing 5 x-ray procedures. The states, conversely, they will sign off on it. They're okay, because they're only going to pay about half to a quarter of the cost. The rest of the cost they then pass on to the government. So now you don't have cost controls in that regard as well. And then the final issue is, because you're paying for services, you're not paying for public health spending. Things like vaccinations, methadone clinics, etc. And the reason a lot of poor people in the U.S. have bad health is not because of the lack of health care. It's because of the way that they live. And a lot of people, you don't want to recognize that, because basically what I'm saying is that the problem is poor people are acting foolishly. But for a lot of American poor, the reason that they're poor and the reason that they're unhealthy is because they're acting foolishly. To give you an example, Medicaid will cover all the expenses associated if you eat potato chips, weigh 250 kilograms, can't get out of bed, and then you have a diabetic attack, and firemen have to come and cut a hole in the wall and use a crane to lift you out. I'm not certain that's a good way to spend money. I'm kind of thinking maybe the guy who ballooned up to 250 kilograms needs some kind of different intervention before you crane them out that way to pay for it. In other words, you need to address things like the type 2 diabetes outbreak. Because so many Americans are eating badly, type 2 diabetes is a huge driver of costs. All the gunshot problems that you have in the U.S. Again, that's not a Medicaid problem, but maybe we need clinics for dealing with gunshot wounds. Maybe some of that Medicaid money ought to be spent on programs just to get people off of the streets and stuff like that. That was the intent of Ryan Care, was to give the states the flexibility to try different kinds of programs like that to deal with it. It should be noted that a lot of the people who get Medicaid don't really want it. They really don't seem to be willing to buy it if you offer it to them at a very, very low price. And they often don't really use it after it's been given. And again, this goes to that difference that I talked about earlier, health insurance versus health care. They're not the same thing. So that's, I guess that's the issue that you have in the U.S. But it should be noted, there are differences between a good hospital and a bad hospital in the U.S. The difference is not as big as, say, between a public hospital in Thailand and Bumrungrad, but there are definite differences there. I don't think that's sorry, I think that's a problem, but I also don't think it's a solvable problem. That's true everywhere in the world. Okay?
So we have the last questions. Do you have any last question? Okay, last question.
If not, I must ask you, as an American friend, you are the first one that I've asked this question. Of course, your elected president has recognized Jerusalem as a capital city of Israel. Now, how do you agree on this or not? And what would be the implication that relate to the leaders, the world leader of the U.S. in the past, and whether it will affect the image of the American as a whole dealing with international affairs?
It's not that Donald Trump has recognized that Israel is the capital. Every U.S. president, since I want to say Nixon, has done the same thing.
They postponed it.
But they, on the one hand, they recognize that Jerusalem is the capital, and then they say, and someday we will move the embassy from Tel Aviv to Jerusalem, but not right now. We're going to hold off on it for whatever reason. The difference is Donald Trump has said, yeah, and we're going to move the embassy. For what it's worth, I agree with the policy. Jerusalem has been the capital of Israel for a long time, and I think the Jews have a pretty good historic claim to Israel, based on, more than 2,000 years of history. So I think it's just a recognition of reality. As to what the effects on the U.S. image will be, I tend to think not a whole lot. European leaders will dislike Trump for doing it, but they dislike Trump for so many other things that, one more thing is not going to make a big difference. The Arab world has made a lot of noise about, but the protests in the Arab world were really quite minor. They're not really that excited about it. And I think that goes to the fact that what really concerns the Arab world right now is the Sunni-Shia split and the Cold War between Iran and Saudi Arabia. So in that respect, I guess I agree with the policy, just on the basis of, hey, a little bit of truth is a good thing, and why not do it now? It should be stated, though, that an important distinction needs to be made between people liking President Trump and people respecting President Trump. There's a tendency to look at President Trump and to say he's intensely unpopular outside the U.S., and there's truth to that. He is intensely unpopular in many parts of the world. That's not the same thing as being respected. Barack Obama was much more popular. I don't think he was more respected. I think when the Syrians used poison gas while Barack Obama was president, he spent 2 months temporizing on the issue, said he didn't do a red line, which he did, and did all this, and he retained his popularity and stuff. No one believed a word he said about what he would do after that. When Syria did it under Trump, 2 days later, Trump blew up a Syrian airbase. That got people's attention. And that, I would argue, made them respect Trump. They might not like him, but they do respect him in that regard. I don't want to push it too far. And I don't want to overgeneralize about that. But it is an important distinction to make. So, my understanding is Trump is very popular in China, actually. That someone did a poll, and the Chinese are madly in love with Trump because they see him as a really successful businessman, and because a lot of them watched The Apprentice for a lot of years. So.
Okay, thank you, Dr. Brian, for your presentation today, and thank you all your participation today. Our time is quite short, but if you have other questions or anything that you want to talk, you can talk to Dr. Brian after this seminar. So in this afternoon, we also have the seminar about the Vietnam. So if you are interested, you can come at 1:30 for Dr. Chiani. She will present something about Vietnam.
Is that in Thai or English?
I'm not quite sure. If some foreigner come, she will present in English. Thank you so much for today.